Natural experiments. So natural experiments are very important in addiction science and looking at alcohol and drug policy, because we rely on them very heavily because we can't really um, randomize people to different locations in a controlled way to experience one policy type or another. So what natural experiments allow us to do is combine the pieces. So we have data from policy surveillance systems to detect changes in policy over time. We have data from outcome surveillance systems that help us detect changes in our outcomes over time, whether that's substance use or whether it's the consequences of substance use. So we use natural experiments to combine these two pieces of information to try to determine the effectiveness of these policies overall and the impact they're having on public health. So these, you may also hear the term known as quasi-experimental designs. These are, and it's another way to call natural experiments. And we're required to use these, again, because we can't randomize people to experience the effects of a policy. We can't randomize people within a community to experience the effects of a certain policy, and we can't assign different policies on a random basis to different communities. Basically, they're putting them in place for one reason or another. But what natural experiments do is take advantage of the implementation of these different policies in different communities. So here is the basic, the very, very basic design. So community A and B are next to each other. And because they're next to each other, we kind of assume they're roughly the same. Now, we know they're not going to be exactly the same. That's just asking for too much. But we assume that they're roughly the same. Community A has implemented some new addiction policy, we'll call it a policy X, but community B has not. They've just have the status quo. So because of that, we almost have like an experimental design. We have community A, which has this new policy, and we have community B, which serves as a control community. So we measure our outcome of interest. Again, the outcome can be actual consumptive behaviors, or it can be some consequence of that consumption at time one. We wait a little bit of time and hopefully time one occurs before the policy is actually implemented. We wait for the policy to be fully implemented, and then we do the same measurements again at time two. So we have this multi-time point two-group controlled trial just in a non-randomized way. That's why it's a natural experiment. It's a quasi-experimental design and not a fully experimental design. Hopefully, our control group doesn't change. That would be a really good control group. And hopefully, since we're talking about substance use, our outcome of interest has decreased. So tobacco, alcohol, opioids, cocaine, amphetamines, the use of that has decreased, or the consequences, the overdoses of that use has decreased over time. That's really what we're looking for, and that's really what we're testing for when we do these types of studies. So again, we hope in these natural experiments, we hope that the community that has implemented the new policy has changed. Most of the time, we're looking for things to go down, but sometimes it could go up if it's things like a protective factor. And we hope that the communities that have not implemented the policy, that their control communities, have stayed the same. We need a control group. And if our control group changes, we have to start explaining why, which kind of takes away from the strength of the evidence we're trying to present. Now, these natural experiments, because they're not randomized, do have many limitations. One could be history bias. So regardless of what policy is put in place, because they are in geographically different locations, they could experience different things that are even related to the policy. So a change in alcohol consumption, for instance, may go up or down for some reason entirely different than a new policy that was put in place. Again, because these communities are not the same people, we're not taking a randomized selection of people from the same neighborhoods, for instance. They can mature differently over time, they can change their behaviors differently over time, and they just may be different. One community may simply be predisposed to consuming a substance, and another one may have an inherent protective factor from consuming the substance. It could be as simple as one community is a high-income community, one income is a low-income community, and if you pick the wrong communities, which are too far apart, you run into selection bias. And then finally, if you just have an extreme community, you may end up having to worry about regression to the mean. There are so many people that use injection drug use heroin that just by natural tendencies, it's going to move towards towards a more neutral average number. They're just so extreme. Or you simply measure a community where there is no substance use, which, while it would be ideal, just isn't really practical. So the next time you measure, it's naturally going to move upwards in some positive direction. So these are some biases and some types of error that you have to worry about when working with natural experiments. And again, these are just some. This is not an exhaustive list, and there are others to consider. So even though there are some issues with natural experiments, why do we use them? Can they be effective? Well, they can definitely be effective, and the most effective, at least in my opinion, is the International Tobacco Control Project. It's run out of the University of Waterloo in Canada, and it was originally designed to determine if implementation of the Framework Convention on Tobacco Control, the international treaty to try to reduce smoking, actually impacts smoking rates. In 2002, there were 4 countries involved. Now, as of 2017, there are 29. So it has grown immensely. They have published hundreds, I may even be over 1,000 papers out of this study now, and it is a very, very effective natural experiment that these investigators are working on. And an example of this is investigating the effectiveness of graphic warning labels. So do graphic warning labels actually impact smoking rates in a different country? And what ends up happening, what they found out, is that yes, they actually do. Using graphic warning labels can actually decrease the smoking rate. It can prevent youth from smoking to begin with, and it can actually help convince some current smokers to both reduce and quit their smoking habits entirely. So while natural experiments are kind of a weird thing to think about, quasi-experimental research is kind of a weird area of research. There are a lot of biases and errors you have to think about. They can be very effective, and they are very effective, and they are very necessary in alcohol and drug policy research.